Module 1. What is policy? Now, in public health, there are many ways in which we try to influence people's health behaviors, trying to improve the health of a community, of a population. One of the major tools that we have is policy. Now, when we're talking about health policy, the typical definition was what we see in the first. Basically, a form of legislation, either at the local, state, or federal level, that seeks to influence or direct people's action, behavior, decisions, and so forth. Uh, but we can actually look at it much broader and look at it as really a wide range in which we initiate um, uh, decisions, legislation, regulations in trying to impact people's health on a wide scale. We will be talking about how policy is developed and implemented throughout the course, but before we do that, we need to think about what is health policy. And here are just some sample questions that can help us think about what is health policy. It could be very simple, and such as with the first question, where are we with healthcare and where do we want to be? The Affordable Care Act is a good example of the kind of health policy that this kind of question addresses. Another is, what other alternatives are available? And sometimes when we're looking at a particular problem, there may not be a single solution, there may be multiple solutions, and that we might have to choose amongst a selection. Sometimes those choices are constrained either by money or by people's attitudes. How can we get there effectively and efficiently? This is an important question, and this is why when we start talking about the role of evidence and evidence-based policy becomes important in terms of how we're going to develop a policy that actually works. How do we show that? And the last point uh, goes into the larger issues in regards to the development of health policy, the political process. Not just the politics, but the social, the ideology, a wide range of contexts that could influence our ability to actually implement a particular health policy. And we'll see through examples how various kinds of, of experiences, various kinds of policies were impacted positively, excuse me, positively or negatively uh, based on social and political situations. Now, in creating a health policy, we'll be actually be working with a number of different stakeholders. And stakeholders, how we refer to individuals and groups, have a particular interest in the process. So we can talk about governments as having an important role in this process, and not just politicians, but bureaucrats as well, and those who work with such institutions. People who work for the CDC and others may also play a role. Political and social organizations may also have a particular interest in a particular health policy, uh, leading towards their own interests in regards to the people that they serve, the people that they represent, play a role. Within any particular area, we also can look at employers, communities, and individuals as also having a particular interest in regards to any particular health policy. And when we're talking about communities, it's important to make distinctions regarding geographic or characteristic communities. When we're talking about a geographic community, we're talking about a neighborhood in Cleveland, for example. We're talking about a community based on characteristic. We're talking about individuals with a common characteristics such as race, ethnicity, religion, and so forth. Those who may have a common history or common experience. And in class we'll talk more about the idea of what do we mean by affected, ally, and contractor, because these are important roles in regards to people involved in public health. So something for you to think about is, in doing public health work, where would you stand? Would you stand with those who are affected? Are you an ally, or are you a contractor? Again, this will be discussed in class. Now, this is a model that describes a process in which a policy is designed, implemented, and utilized. There are many other kinds of models out there. This is the one that we'll be using in class. One is not more better or worse than the other, but this is the one that I prefer. Now, in thinking about health policy, or any kind of policy, it starts out with identifying the problem. And from there, once we identify the problem, we then start thinking about solutions and how do we deal with the problem. And that's the policy formulation aspect. We start to design the policy. Once we have a particular policy designed, we can then start talking about how do we implement that policy. How can we then make sure that what we have in mind can then be implemented correctly. And then from there, the policy is in place, and then we need to start thinking about how well the policy is being implemented, how successful is the policy in dealing with the problem. If there's any issues, that takes us to the policy modification portions, which takes us back to the policy formulation and implementation portions. That is, we need to identify if things are not working, how do we make it better? And then the process repeats itself. Now, under all this, we see the idea of social, economic, political, and historical factors. This entire process, can be described as being a very rational process, are very much influenced by these larger factors, for good and bad. And as we start discussing and looking at specific kinds of health policy, we'll start to see how some of these other factors can play in design and implementation of certain policies. And we can also talk about how these factors could actually play a role in actually identifying and actually defining the problem. What is actually a problem is very much up for discussion as any other part of the health policy process. Now, when we're talking about the role of some of these overarching issues regarding the health policy process, that brings us up to two important concepts: windows of opportunity and unintended consequences. Windows of opportunity, those are certain social, historical, economic situations, forces that occur which makes policies, the creation and implementation of policies, more or less likely. An example being is the effect school shootings may have on people's desire for legislation regarding guns. When we're talking about unintended consequences, we're talking about situations where things happen due to the result of passing a certain policy that the people who designed the policy didn't plan for or didn't initiate or didn't think of. An example of that being the rise of organized crime when we're looking at the process of making alcohol illegal back in the 20s. People who were for alcohol prohibition at the time, didn't see any of those situations arising. They felt that once they made alcohol illegal, the society would have been improved. Things would have been better. Things didn't turn out as they expected. Such it was an unintended consequence. So keep this model in mind as we go forward in class, because we'll be referring to it or talking about it throughout the class. We'll be talking about how certain policies are thought up, designed, implemented, and maybe changed or repealed for that matter. And also, very importantly, thinking about ways these larger forces in society can actually influence this process, because that's actually a very important part of the health policy activity that we'll be looking at.